what you concluded from it.
Good morning, Brian. So it was very clear that 99% of people who had natural immunity, that is, they recovered from COVID, had antibodies, and those antibodies were present nearly 2 years after infection. And the immunity long-term was identical to the immunity short-term, and the immunity long-term was also protective against against Omicron, better than the data shows against with vaccines against Omicron. So this is a study which we've been doing for months. I don't know why I have to do the study and the NIH can't do it with $42 billion, but it does show that natural immunity is durable.
So that's what you in the Wall Street Journal column today, but it's so impactful. So you at Hopkins, you said, hey, I got the people, Americans infected with the antibodies, so I got the study, it's easy, 295 people. Let's see 2 years later if they still have antibodies. The answer is yes, would lead you to conclude that public officials ruined many lives by insisting that workers with natural immunity to COVID-19 be fired if they weren't fully vaccinated. Now, knowing this study is correct, it's time to reinstate those employees with an apology. The CDC study and our study confirms what more than 100 other studies of natural immunity have found. The immune system works and your immunity is present and durable, at least as into today, at least comparable to the vaccine as we know it. So, Dr. Marty McCary, what are you calling for the public and the government to do?
Well, first of all, Brian, the study was not that hard to do. We invited hundreds of people who were not vaccinated and only had been exposed to the virus and tested their blood. I mean, this is not, a Nobel Prize winning study. This is basic research. And the NIH and public health officials have argued the entire pandemic that the durability of natural immunity is unknown. Well, just study it. Now, there's a series of studies coming out on natural immunity around the country, and they're going to be forthcoming in the next few weeks. CDC put one out last week, which shows it's about 3 times stronger than vaccinated immunity. They've been afraid to talk about it because they're afraid people might just get the infection. We don't want them to do that, but we can be honest with the data. Now we've got the great irony that we have fired workers for not being vaccinated, even though they had natural immunity. When we fired those workers, we fired those least likely to spread the infection in the workplace.
Should we hire back the Marines? Should we tell the Army men and women to go back, put on the camouflage again?
Look, this mistake by public health officials destroyed thousands of careers in the United States. Soldiers dishonorably discharged, they need to be reinstated. Nurses, teachers, hospitals are going into emergency crisis mode. One hospital system, by the reporting of Jason Rance, shows that they fired 55 workers in Washington state for not having the vaccine, even though many, if not all, had natural immunity. And then when they went into crisis staffing mode, they invited staff to come back even though they were COVID positive and had symptoms. They said, we still need you to come into work with COVID and try to be assigned to COVID positive patients and avoid the immunosuppressed patients in the hospital. This is a manufactured crisis because the Center for Medicare and Medicaid Services has not recognized natural immunity in that immunity requirement.
Change that, and hopefully your column does that in the Wall Street Journal today. Dr. Marty McCary, thanks for you and your colleagues for doing this study.
Thanks, Brian.
Still ahead.